Thank you for joining us. My name is Dr. Melanie Lantz, and I'm really excited to introduce for you all tonight's webinar, Preparing for Our Future, Rethinking Our Work as Psychologists. We're hosting this webinar on Division 17's webinar panel or webinar platform, so we're grateful to Division 17 for allowing us to host this webinar tonight. And Division 17 has actually given Sandy Shullman, who is with us this evening, their #1 endorsement for APA presidential candidate. We'll talk just a little bit more about that in a moment. So after this webinar is over, or in case you're not able to stay for the whole thing, you can catch this webinar on the Division 17 website or their YouTube, and I do believe we're also live streaming on Facebook this evening. So without further ado, let me tell you a little bit about our panelists so that I can turn it over to them. We have with us this evening Dr. Judith Blanton, who's an organizational psychologist in private practice in Pasadena, California. She's a former president of the Consulting Psychology Division, which is APA Division 13, and works with leaders, teams, and organizational systems to help them become more effective and vital. We also have with us Dr. Kevin Arnold, who is a former president of the Ohio Psychological Association and the president-elect of APA Division 42. He is a practice leader in transformational models in independent practice, including integrated behavioral health in primary care offices. And tonight with us, we have Dr. Sandy Shullman, who is president for the APA presidential election. So Dr. Shullman is an organizational counseling psychologist, and so really important in the blending of those two fields and bringing those strengths together. She is a managing partner in an organizational consulting firm, and on the ballot this fall for APA president-elect. So I'm really excited to introduce them and to turn this over to our participants.
Well, thanks, Mel. Really appreciate that. Good evening, everybody. Thanks for taking the time to talk a little bit about a topic that's a passion of mine, which is the future. And I am running, I think, for APA president because I really want us to imagine and create a successful future, which I believe we can do, but we have to plan for it. We can't just react to what happens. So what worries me is that we as a discipline, as an applied group, as a practice group, are not regularly talking about this issue together. I certainly don't have all the answers, nor do the people here with me, but we are a team. But I know from my work with organizations that you have to ask questions and you have to imagine things to begin creating. And you must create and learn in order to change and thrive. So that's why I want to start creating some of these dialogues, because I want people to just start thinking about what's going to be different. I want to get us at APA, and when I say APA, I mean APA and our members. I want us to be thinking about more systematically asking and addressing these questions of the future. Our future and also the public's future. It's not just about us. We need our best energy and commitment right now because everything is about to change. And we need to be as ready as we possibly can be to model the way, lead the way, and change in a productive way and help the public. So we need to go to the edge and see what's coming, both the threats and the opportunities that abound right now. We can change and create the future in ways we have not yet imagined. And so that's why we chose, and the questions that came in primarily focused on these 3 key themes at this point, about social and ethical implications of all the technology and human interaction, a revolution that's coming, about future practice options. Everybody wants to know what we're going to be doing, and enhancing the impact of psychological science on public policy, because we see so many needs in our society and internationally. So that's what this is really about. I want you to be thinking about this. If you walk out of here with just a new thought or question, then I feel like we've had a good opportunity to get you engaged. And I would make the commitment, if there's a burning question you have that we have not addressed and you would like to talk more about it, you'll be able to send me a note at the end, and I'm happy to engage with you personally about it and make sure I understand, because your questions also help me potentially as a candidate think about what's best to do. So the approach here is we're going to take each of these three themes one at a time, put a few ideas out to stimulate thinking, make a few suggestions, ask for some input, and then do this as 3 rounds, 3 lightning rounds, and then go from there. So the first theme I want to get to at this point in time is the whole question of the human-technology interaction. I'm using that term very broadly. It's all about artificial intelligence. It's about robotics. It's about big data analytics. It's about a lot of things. But these were some of the questions that you brought up. If you can see them, if you're on a screen, you'll see a lot of people had questions about telehealth. And then there are also questions about the future, not as many about broader technology issues. One question that I thought was really important that we'll address directly shortly is, what should I be thinking about now in terms of technology in my practice? Let me just say briefly that my first formal experience with virtual reality as part of human technology interaction was in 1969 as in an experiment at Harvard University. The professor that was in charge taught developmental psychology and its applications to education. So this is the Harvard Graduate School of Education. His name was Jerry Lesser. He partnered with a group called the Children's Television Network Workshop, and he created a science-based educational television program for young children. And at the time, it was thought that television might be harmful for kids. We can still make that case today, probably. But he targeted educational television for young children. It aired for the first time on November 10th, 1969 at Sesame Street. And I can tell you now that this was a perfect example of a psychology business partnership, because the people that were producing the Children's Television Workshop had no idea when they signed on with Jerry Lesser how much he was going to ask them to look at the design of the program, the evaluation of the program, the content of the program, all from a science base. And so this is a wonderful, I think, metaphor and prototype for me for what we're trying to do now. Our tech questions right now tend to focus a lot on telehealth, but that's really, for me, only the tip of the iceberg. We have all these other deeper technology changes that are going to be happening. And I think we will find that there are both opportunities and really great challenges for both us and the public. So I want us to be thinking about this. I think the biggest issue that's important about this is your worldview about what you think is happening. You can have several worldviews about technology. For some of us, it might mean, gee, we're going to lose everything that we've ever been doing before, and that's what's going to be the change in everything. What are we going to do? We have nothing left to do. Everything's going to be manualized. Everything's going to be robotic. Everything's going to be, I'm going to lose. And by the way, these worldviews are not independent. You can have any number of these at the same day. A second worldview is basically that it is an opportunity actually to really expand what we are doing, that it's an opportunity to do things in a different way and give psychology away. We've talked about giving psychology away in many ways, but in putting it into technology, you're taking that knowledge and you're putting it into something that doesn't require you often always to be there to have it. So we can be thinking about it from a giving psychology way perspective. Another way that's intriguing, and this actually was something that I was quite taken with at a presentation at the California Psych Association this past April from Ricardo Munoz and his colleagues, I think one of which Nancy Haug may actually be on this call, and they were very, very impressive. And they really focused on how technology can help us expand psychology's reach, not give it away, but create more of an engagement of psychology with more people who wouldn't be able to benefit from it. And then I think another view that you can have about this is also we finally have a way to maybe create prevention, follow-up, and maintenance regimes in the work that we do on the applied or practice side in a way that actually is cost-effective. So I think that's something to begin to think about is what's your worldview about this? Are you thinking about this technology piece as a nuisance or something that could really re-energize psychology and make it something very special in the future? The other piece I just wanted to raise there was also the issue of that it's not just human or technology, that there's really a continuum. You know, you could be basically doing everything face-to-face, and as Munoz and his colleagues pointed out, you could be doing things that are augmented by technology. You could have things where the person is self-guided, but maybe has a coach periodically to make sure they're being self-guided in the right way. Or it could be completely automated where people just get on when they want to with whatever application or technology it is and do it at their own pace, their own time, in their own way. So I just want you to think about where things might be. They're not all or nothing. This is not a 0 or 100% proposition. Judy, could you talk a little bit about maybe the telepsychology piece?
Yes. Well, one area is there's such a lack of clarity even in our language, and some people have pointed out even tele is outdated because we're dealing with electronic media, not just telemedia. So we work with medicine, talks about telemedicine, telehealth. We're also talking about telemental health, but there are also people who are non-clinicians who are using telepsychology in the organizational arena, for example, in education. So I think we've got to be clear about, if we only talk about telehealth, we're leaving out a whole group of psychologists who are using electronic media to hold meetings. I hold meetings with the executives on big screens, and some of them are in another country, and some of them are in New York, and some of them are in the room, and they can interact in a way. So we have the language to deal with, but I think even more importantly is some of the current legal and ethical issues, because we have in the United States this 10th Amendment, which means that all licensure is dealt with by the states. So we are not able to have a law about telemedicine or telepsychology that goes across each state. And right now it is really a patchwork, which makes it very difficult to operate across boundaries. The Association of State and Provincial Psychology is working very hard to create what they call a compact, which is another legal entity that needs the support of each state legislature to create a model that goes across state lines. And the emergency people are using this now, and the nursing people have been able to use this legal process to get around some of the complications of each state having its own laws. So if your client is on vacation in Florida and you're not licensed in Florida, Florida says you're not supposed to talk to them.
Yeah. Judy, one of the other things that I think is important is if we could create a more of a national conversation about this. Psychology isn't having a national conversation about this. It might put more pressure and incentive to make the compact work. And we haven't really been doing that at a national level. We are not the only profession or the only vocation that is having trouble dealing with the notion that things are state by state by state. And I think if we are paying attention to the trends and we get the right partnerships going, I think there's some opportunity for us to create a national conversation, particularly now that a lot of the technology platforms are being asked to look at the needs for some underpinnings and some regulation.
I absolutely agree, and I think we can learn from what the emergency people have done, the nursing people have done.
Yeah.
And we have not really directly worked with the states. That the Association of State and Provincial Psychology has been the group that's been working with this, and I think you as president could be more involved with them. We have not created as strong an association with them as we could, and if we want to influence this, we're going to have to be a little bit more politically savvy, and I think step forward.
Thanks.
Not wait and complain.
Thanks. Some of you also asked some questions about the ethical opportunities and challenges. I think the short answer to that question is there are many. But I don't want to lead with fear. I think what we have to lead with here is there are opportunities, and this is going to be such a major change that we're going to see a lot of mistakes. Not just that we're going to make mistakes, but other groups that are working on technology may make mistakes. So these are some of the things that people just need to pay attention to. And I'm going to emphasize 3 of these, and then some of these other ones you're going to be a lot more familiar with. As we develop public policy, we're going to be using larger and larger databases to make public policy. We have to be very careful about the data that we are collecting, and that's ostensibly for the good of the public, in terms of their consent to have that data used to even make public policies. There's going to be so much data available that we have to think about duty of care with that data so that we don't unintentionally become one of those big data groups that lands up hurting the public. The second thing is that as technology gets built that does human technology interaction, the technology itself is amoral, but the people that design it are not. And so they might be moral or immoral, but the technology is not the problem. It's the design that gets built in. We build moral choices into technology. We also build in bias into technology. So one of my big concerns is that we lead the way in being part of design teams in technology to help them think about the human behavior technology interaction as they're designing the intelligence that gets programmed into this technology, so that we are inadvertently creating larger chasms for marginalized folks in this culture, that we are making moral choices when the technology has to make a choice. And so that's really important to me. And then the third issue is safety. If we are going to give people complete access to do things, we have to think about what are the best ways to keep people safe when they are remote and we don't have some of the options that we have now to work with them. So, questions that you might have. Anybody have any questions about that? Here's the questions that we thought, and Jeff MAGNAVITA put out a book in April of this year through APA Books on mental health treatment and technology and what questions we need to ask. I think this set of questions that we have he's provided here is an excellent set of questions that for anybody that is either in applied area of any kind or practice to think about in terms of trying to get into the technology space. This is not something that you want to wait to see if you need. This is something that you should think about now, because it's going to change the way everybody thinks. It's not going to just be about healthcare or psychology. As you well know, you have changed everything else about your life at this point. How you shop, how you entertain yourself, how you do your other work, how the rest of your client bases do their work. Every system in this country, everything is smart now. Your refrigerator is smart. Your clothing is smart. Your car is smart. And so everything is changing. So these are the questions that I think that would be really helpful for you to think about. And when you don't have the answer, which many of us don't have the answer at this point, it becomes a dialogue and you find trusted, competent colleagues that you can work this through with. Let's go on to the next one if we don't have a question here.
I have just one maybe comment.
Sure.
That's the issue about the ethics. We're going to be revising the ethics code. And this seems like a really important issue to deal with in the ethics code. Can you talk about how you might address this?
Well, the ethics code for me, I'm glad that we finally, a number of years ago, had some specific guidelines around telepsychology and telehealth. The ethics code, I think 2 things. First of all, this has to be a major piece of what we consider the context for the next ethics code. It is one of the reasons, for example, why I pushed very hard for the charge for the ethics revision to not be a tweak, but to be a major, major revision for 2 reasons. One, because of the changing cultural context that we have for people, but also the changing cultural context we have for technology. So this has got to be a big piece, and I'm hoping that the technology of the ethics review, the ethics group that is working on the revision, is consulting regularly with people in technology areas to look at the impact, and also to create in the new ethics code ways that we can more quickly respond and update the ethics code, because changes are not going to happen in 10-year cycles as they've happened in the past. Psychologists are going to need guidance more quickly because the world will be changing more quickly.
Thanks, Sandy. And I think we have time for one more question in this section. We have a question from an audience member who asked, can technology create disparities when people don't have access to a smartphone or a computer?
I'll take a first shot at that, and someone else can go in. Yes, I think one of the downsides of all of this that I'm extremely worried about is the potential for a lot of disparities. One is access to technology, and the second piece that I alluded to before is the actual majority view of the world being built into the technology itself. So there are all sorts of ways that the digital divide could actually divide us further if we are not out there being part of the design teams, the policymakers, and the conveners of these groups that are working on this technology to incorporate and understand both the economic and cultural and ethnic disparity differences that there could be to access, but also the actual internal design of the technology itself. What we think the right answer is when that technology has to make a binary decision. Is it a decision that everybody can live with, or is it very person, culture, situationally specific?
Thanks.
I might add that I'm reminded of the research that came out about 15, 20 years ago in urban planning and human behavior. It showed that when you build very useful community centers, but you build them in ways that make travel to them for the indigenous neighborhoods extremely difficult, like locating them across large highways where people have to cross several lanes, people don't go and use them. And I think by analogy, the technology availability access points, as well as the design for the usage of the technology, has a similar challenge in front of it. You can build great material, you can build great programs, but if they're not easy to access and the technology to use them isn't available to everyone, and they're not built to be user-friendly for all populations, and that might mean building them differently for some populations versus another, you'll end up with great community centers that nobody can get to.
Yeah, I agree. And that's where psychology could be really critical, is how do we make those technologies relevant to specific populations and individuals? And then the issue, obviously, of how do we make sure that people have open access to them?
All the work that's being done now to work with underserved populations and people in rural areas using telehealth, telepsychology to connect with these people, but they also have to be able to have a telephone or access at a library or somewhere where they can actually connect with the psychologist. So I think we're getting the technology, but we have to ensure that the people have access to it.
Yeah. Well, and that's why we need some other partnerships. We need to partner and work with the technology groups that are providing the access to the technology, that are building the technologies and the access points.
Yes.
Thanks. That was a great question. And a reminder to all of our participants, you're welcome to continue to submit questions as we move along through the chat or the Q&A features. I'm keeping an eye on both.
Thanks. Okay, our second theme is the future of practice. This is the evolved version of what am I going to be when I grow up, as in what's going to happen to practice. I know a lot of people are very concerned about that and have been concerned about that, not just because of technology, but just because of what's happening in the U.S. healthcare system right now. So people have questions about, where's our role going to be in the healthcare system? I have an initiative that says I really believe that we have to redefine practice again to really get in the public's mind the whole issue of applied psychology, that anybody that is applying science, psychological science, to solve a problem, whether it's an individual issue, whether it's a group or a systems issue, is doing applied psychology. And I think if the public could see the range of things that applied psychologists do, which includes people practicing in healthcare, I think it would strengthen an understanding of how powerful our science is to solve human problems. And so that's one of the issues that I think we really need to bring to bear in this situation. I know one of the questions that came up was, will there always be face-to-face therapy, or will we be talking to robots, artificial intelligence, or to a screen for the rest of our lives? And I do believe there will always be some, well, when I say always, as far out as I can see, some place for face-to-face, but I think it's going to be of a different nature. You just have to really think about, it's a very analogous question, even though this sounds kind of trivial, is there always going to be a place for a store that you can go to buy things? As you see the balance of the distribution system change, I believe it will change over time, but I do believe that face-to-face will be very important as we continue research to see for what situations, what individuals, and what context face-to-face continues to be the most effective intervention. I think there will be room as we emerge in the next few years that specialties will still have face-to-face components in that. I think people that have both access and privilege and economics will still be able to do that. And I do think there will be specific populations and types of challenges that will be best done face-to-face. But that does not mean that I think it will stay exactly the way it is now. And I think, so that reality has to be, what are those things going to be? So I think both face-to-face and other technologies will all be in our future. So the other question that probably nobody likes to talk about, because it's kind of our third rail right now, is, will master's level clinicians be considered psychologists? Someone asked that question. My response is, we don't know that yet, because we have just, the APA, the council just passed last year a resolution to look at how we build accredited master's programs, so that we look at the certification of those programs in terms of content and curriculum. I think the more important question that I'd be asking right now is not whether master's level clinicians will be considered psychologists, but what will PhD psychologists be doing in the next 5 to 10 years? To me, that's the more significant question that we have to answer, because I think with a lot of the pressures on the reimbursement systems and the pressures for shorter, more routinized treatment, we have to think very seriously about how we will make the greatest impact as PhD psychologists. And I'm going to ask Kevin to address a little bit of that, because I think one of the reasons I like teaming with Kevin is that he thinks a lot about the future of practice in really interesting ways, and I'd like him to share a little bit of that.
Well, specific to the master's issue, let me first say that, again, what you said, we don't know where we're going with it because we just began to consider it.
Yeah.
But I can say that in practice, the shortage of psychologists is remarkable. We have a number of opportunities for psychologists to be practicing now. Hospitals are employing them. Physicians' offices are employing them. The kinds of practices that are doing integrated and co-located healthcare with physicians are employing them. I'm employing them. What I do find, though, is that the master's level clinicians that are available that are not trained as psychologists, and I'm not saying that they would be called psychologists by saying that, but that are not trained in psychology programs, are uneven in their competencies, much more uneven than I find psychologists to be, or for that matter, master's level school psychologists working with children when I interact with them. So I think one of the challenges about the master's level issue is how will we respond to the access needs and the service needs of the population that are currently there. These aren't futuristic needs, these are real needs today for access to quality, effective care. And we can't provide enough psychologists into the work stream right now. That's a reality of it. It may be surprising to folks to find out that the match problem, to give you an idea of the human resource needs that we face, the match problem for internships that existed 5 years ago has so reversed itself that internships couldn't get enough applicants to fill all of the available internships in 2018. So we have to be thinking a little more outside the box. I think PhD level psychologists have to consider ourselves, we're the equivalent, from my vantage point, of MDs. We're the application of science to the psychological and the behavioral issues, the way that medicine is the application of biology and chemistry to physical illnesses. We bring a scientific bent to the delivery of services that I don't believe master's level folks will be able to capture. We know not only what to do, but we know why we're doing it. So when it doesn't work, we can figure out what to do differently. That's not likely to be the purview of a master's level individual who's implementing a manualized treatment. So I don't think we'll ever have a problem in delivering services and having a role as PhD psychologists. If it's okay, I'll talk a little bit about where we'll be in what I would refer to as enhanced co-location as well as integrated care. They're different concepts. Integrated care is very much a team. Each patient has access to the behavioral health provider equally without having to go through the physician. But in enhanced co-location, we found that the community primary care physicians, in the current model anyway, need psychologists to be in their offices, but not just an office in an office, but instead to be integrated as effectively as they can in the operational systems, as well as collaborating with them. So it's coordinated care at every opportunity. But let me say that this brings up the issue of general applied psychology. I'm fortunate enough that I was trained in applied theory beyond just health service work or clinical work. I was trained in systems theory, and I had some training in organizational work, both at the doctoral level and then after I was licensed. I don't know how we can integrate effectively, particularly community primary care, if we don't understand how to help them adapt the operational systems so that the ease of information sharing and the ease of contact with them is there for them. They don't know how to adapt systems. They don't know how to apply psychology to operational implementation the way that we do. These are human beings interacting with one another through technology and other means. And that's our bailiwick. That's what we know how to do. I believe that a part of why we'll have a premier role in healthcare is because we can do those things. We know how to make the system work in addition to delivering effective clinical options to patients.
Yeah, I'd really like to support that, Kevin. When I think about what are the future roles of practice, there's going to be a lot more interdependence of roles. It doesn't mean that you're always going to be physically in the same room with 20 people doing things, but it does mean working with other professionals. And I believe it means also, when I say team, it also means working at multiple levels and systems. I think what we have to offer the healthcare system, some great future roles for psychologists, is in the area of team-based science and also in organizational systems, as you're talking about. Because I think if we would add that to the repertoire of what the public, and when I say the public, I mean not just potential patients, but also the public being policymakers and drivers of healthcare systems, if they can see the capacity of what we can bring as a group to healthcare settings, I think we will strengthen the position and create all sorts of roles for psychologists as consultants, as team developers, as people that create a lot more treatment opportunities, that work with ongoing problems as they're happening in the organization every day and help with that adaptive process, because our healthcare change system is in such flux that I do believe there will be such opportunities for driving change initiatives in healthcare organizations. And that's why I also want psychologists to be prepared to manage and drive change initiatives for the good of the systems they're in, the good of the patients and clients, and of course for the good of psychology and psychologists.
Can I add?
And I just want to take if I could just for a second, somebody raised the issue of my use of PhD level psychology, and I apologize. That is, in fact, an issue that I constantly have to come back to, because when I was in graduate school, there were no PsyD programs. So I apologize. When I say doctoral level psychology, that's what I mean, doctoral level psychologists.
Thanks, Kevin. Hey, Jude, go ahead.
I want to chime in because we've been talking about the healthcare system, and clearly I think we've got some very optimistic comments from Kevin about the need and the opportunities to expand in the healthcare area. But I also want to say that psychologists, I think the wave of the future is going to be that psychologists are going to be involved much more beyond the healthcare area, that we are so identified with healthcare. But we have some people where, the IO psychology has been named by a number of these organizations as one of the professions of major future growth in the next 10 to 20 years. We have people working at NASA that are working with the teams at NASA to how to have people who are going to be traveling to Mars, how can they live together? It's not just technically getting them to Mars, but they're going to have to live together for periods of time. And they're already working with the space station to have people who are in confined spaces. So I think working in the organizational arena, the community arena, in administration, I think there's a big opportunity for people outside of healthcare as well.
Yeah, that's great. One of my presidential initiatives or things that I really want to focus on is the psychology workforce of the future. And in order to do that, we just have to get a greater focus on APA, on making accessible, understanding where psychologists are working now and where doctoral level psychologists can be working in the future. So where this whole issue of, for me, of where the future and what's happening in technology, et cetera, we need to put some of our best minds together across the spectrum of functions in psychology and really look at what are going to be some of those work roles. I think we can both try to predict some of them. I think we can create and define them and put them out in the market, because a lot of work roles are changing. And we have a changing healthcare system. We have changing technology as a context. We have lots of other things that are changing. This is a great opportunity for psychology to put itself in the marketplace at the doctoral level in a different way than we ever have before. But we have to work together to do that, because we are coming at the changing context from multiple levels of intervention. And that's what's going to be the extra power. It's the power that we have. It's not just that individual roles that we play, but it's the collective roles in the systems, the teams, and the organizations that we will work with, that we can create. So we can team and advocate at a much different level of impact than we ever have before, if we understand the role that the various groups in psychology all play in healthcare systems, in communities, in educational systems, in work organizations, what I would refer to as our kind of pillars of community, in our pillars of our society and culture. If we understand what those roles are that we all play, rather than just being organized by the type of psychology we do, if we become more focused on the communities and contexts in which we are bringing all of psychology, I think the public will see us in a very different way, and there will be many more roles that we can't tell you what they are right now because they don't even have names.
It's wonderful to hear the passion and the interest for the future of practice. And on that note, I think we have time for one brief question before we move on to our final theme. One audience member asks, for some of the trends that we were talking about throughout this theme, how do we help independent practitioners adapt to these trends?
Do you want me to take that? I have some. I think the way we help them adapt is, first of all, we do a paradigm shift in the way that we think. We think of ourselves, when we think of independent practitioners, as office set up. Maybe we're in a group, maybe we're in a single or a small shared office setting, and we think, well, here we are, and people have to come to us. And that's what defines our independent practice. What I would suggest is that we shift the paradigm, and that independent practice views itself as the front line of applying the science of psychology across various settings. Health service settings is one such setting. And there are preventions, for example, to be done there before we even talk about interventions. We can be training parents of newborn children on behavioral parenting, for example, in the waiting rooms, in physician offices. But think, too, about the role of the independent psychologist connecting to a school building or a school system, and engineering systems change that's designed to prevent the kinds of data we saw come out yesterday on CNN about transgendered youth and their suicide rates and their marginalization and isolation that occurs as a result, I would argue, of what we do, of doctoral level psychologists not having gone into the schools to build systems that reduce or eliminate those marginalizing experiences for them very early on. We can reinvent the way the operational system of the school is on the human level, not the curriculum level, not the building design level, although we have a lot to say about that if we apply ourselves, but on the way that adults and children interact with one another, and we can help them redesign it to prevent the kinds of things that we saw in that presentation on CNN of that study that was published in Pediatrics.
I would also add to that, Kevin. I think those are incredibly positive ideas. I also think with that paradigm shift then, that APA, for example, there is an incredible amount of data, research, and information that it's very hard to get if you're in independent practice. And you don't have 3 hours to try to search through and get. I don't think we have done a good job with our own sense of translational science for independent practitioners, so that we can more directly keep up, be very current on research, and so that when we have a half an hour, we actually can learn what's trending and things that we need to be paying attention to, so that we can do our reading, our continuing education, etc. I also think that the future of practice is such that there's going to be more emphasis on, I'm going to use the term continuing education here, not because that's the term I mean, but that we're going to have to do more education as we go in the future, because the world is going to be changing so fast that I believe no program, no matter how much we change the curriculum of PhD and PsyD programs, no matter how much we change this curricula, they can't keep up with necessarily current things. We have to make it easier for people once they go into practice to keep up and keep new skills and areas to expand their practices in. I also believe that at an APA level, that we need more options for practitioners to talk with APA people, not just to hear from APA people. There's a lot of one-way communication or complain on the other side. We don't create regular places where practitioners can really talk about trends that might be happening at a national level. Maybe some of the partnering with some of the divisions like 42 and some of the other practice divisions would be helpful, but I think hearing from a broader array of practice people than just the people that are in your sphere of influence could help independent practitioners tremendously. And I think we could facilitate that. We have the technology now at APA and in the world to really make being an independent practitioner not a lonely experience or a sole experience, just an independent experience.
All right, thank you, Sandy, and all of our panelists. So as you continue to have questions as we move through our third and final theme, please feel free to continue to submit those. I know one came up about financial dependence on third-party payers, and we're about to move into public policy. Those two things are probably not unrelated, so we may get back to that question, but if we don't, we can also make sure to get that question to our panelists later as well.
Okay, so we're talking about enhancing science-based public policy. I know people have concerns about that. Here's the way I think about it, and then my colleagues, I hope, will jump in. I think that what has happened, sometimes by necessity, is that we have been, as a discipline and as a profession, very reactive to the events that have happened in our lives, that in terms of public policy that affect both psychologists and the public. So I always feel like we are scrambling to go to whatever issue has emerged. And so my notion about this is that our science, we use our science and organize our science differently for our members and the public, we can have greater, more consistent impact. Let me give you an example. Probably one of the places where the public and policymakers see psychology as experts is in stress. One of the reasons I believe that happens is we've had a very successful initiative with the Stress in America. It's something that happens every year. It happens regularly. We update the science, and the public begins to depend on us to come out with the thermometer that says, where are we with that psychological concept in our culture? I really believe if we would create some topic teams, I know we have boards and committees, but if we would better utilize team-based staff and members of our association to really be ongoing teams around issues that we know are not going away, like immigration, like violence, like poverty, where these people regularly, you could think about taking 5 or 6 major issues in public policy, and we could regularly, maybe annually, put out a report on what the science says about those issues, what psychological science says about those issues, no matter what the specific issues are that are emerging at that moment, but that we provide a regular flow of information to public policymakers about the science of psychology as related to key issues in public policy. They will come to rely on us for those things. Another example is I think we created an incredible body of knowledge about LGBT relationships. And we created a body of knowledge. We were able to use a number of amicus briefs so that LGBTQ people could get married. When we got to the debate about custody, we had science we could apply. But that was because there was a systematic foundation of research, partially funded by APF and by a group of people that systematically over time put out a lot of research. So I think if we have research programs and expert programs that we were regularly sharing with the public over time about major issues, then when we put out our policy statements, they can see that they are based on science and they will see us as scientific experts. And that's, I think, part of what we need to do. I also believe that we can use technology ourselves to generate bigger data sets to understand public policy, but we'll also have to pay attention to our own biases and issues as we begin to do that. I also believe the other thing that we could do is to create some very different public policy partnerships. I believe that we need to spend more time in public partnerships with other types of organizations and regulatory bodies than we have in the past, because those groups actually do recognize the power of our science. I was really struck. I attended APA's Science, Mind, and Technology conference this past spring. It was phenomenal. It was stimulating. There were people from all sorts of disciplines there. And what the scientists there were saying, the STEM scientists who were there from MIT, from Stanford, from Harvard, were saying is we need psychology in the mix of our discussions about technology. And so here's a good example of how we could engage in public policy development by being a convener in those situations to help the promulgation of public policy. So here are some questions that we had about how to avoid becoming too political. I think if we use our science and our strategy, we don't have to be political. We can be scientifically pointed. I think what we haven't done, though, is combine, as an individual in a state, say at the Ohio Psychological Association, if I really want to create a body of policy around a particular issue, I'm not sure the best way to go to gather all that information except the hard way. And I just really think, again, if we amass experts and panels that are prepared to consult, to organize in relevant databases, science that's related to specific policy issues, then we make it easier for us not just to appeal to our values and our morals, which are important, but also to appeal to the existing knowledge that's there that we can create as a basis for our public policy efforts. And I do believe that the partnerships we need will be very different than the ones that we have had. I think it's important to focus on Capitol Hill, obviously, but I think a lot of public policy happens at the state levels. I think a lot of public policy happens in private organizations. I think a lot of public policy happens in regulatory organizations. I think we need to rethink where we focus our interactions about our science with public policy makers. Any other thoughts from my colleagues on this one? I know I've gone off on that one. I'm very passionate about it.
Well, is it okay if I respond to at least my thoughts to one of the questions that came up in the Q&A box?
Yeah.
So the question up in the Q&A box right now is, what suggestions do you have to advance psychology to people/public to complement public policy initiatives? Are we too hesitant to declare rather than qualify statements? There's a brief answer: say yes when people ask. That to me is the key. Public policy folks, I think, always seek out input and sometimes really thirst for the input. But I think that we may be a little too hesitant to step in and say, okay, I've got an hour that I'll give to this politician or to this regulator or to this public policy writer. I'll give an hour to them for free. I won't look for reimbursement for it. I'll know that will come back to me in some way or another. It's an investment when we take what the psychological science has to say and we give it to the public, and in particular, not just to the public, but policymakers. But the public, the access ports to them are so broad now. There's social media. I have a blog that's been read by over 1.5 million people. This blows my mind. Who are these people reading my blog? I think to myself. But it helps to understand how to harness the information. So the ways to get the information out through Facebook posts, through Snapchat, or if it still exists, I guess, in another year or two. But the mechanisms to get it out are varied. We have to become confident in messaging out. I do think we qualify our statements far too often. I remember Ted Blau once giving a presentation when he said that one of the worst things that we do to graduate students is teach them to never believe they know anything through the process of the examinations that they go through. That may not be quite the case anymore, but it has always stuck with me that we teach ourselves to be hesitant when we should be more declarative and definitive. We do know a lot of things.
Yeah, I would agree with that. I really would agree with that. I think another piece of this is that I want to highlight here one of the thoughts that I had about the C3, C6 integration of advocacy that we're going through now. I think the way we think about that integration is going to be very critical in whether or not we can enhance science-based policy. I don't see that integration as just putting a whole bunch of government relations people under one roof or just solving a membership or income flow problem. I have always seen that integration as meaning that scientists learn to advocate for practice and practice learns to advocate for scientists, and that most of that is likely to happen for many things at the state level. And I believe that the way we deal with that integration, the way we configure the staff, the way we bring in our members into that integration for advocacy will make a big difference. I think there's a major role to play for our scientists to come into psychology advocacy, not just to advocate for science, but to advocate for practice. And I think practitioners have an equally important role at explaining to the public why science-based interventions work better than just, what somebody told them in a bar last night. And I think that's the kind of work that we have to do together again at all different levels with different partners to make that go.
I totally agree.
So here were a few other questions that came up, what we call the general questions. What's our future? Where are we going? Where are we going as a science and profession? Just a couple general comments. Whatever we're going to be doing more interdependently, I believe. We're going to be doing it with much more emphasis on context, and that context can be any visual, geographic place, any type of organization, but it also is about culture, multiculturalism. I believe that one of our key roles in the next 10 years can be to be, as I think APA has already stated in some of the conferences they've had on technology, as a convener for many interactions. People talk about, is psychology going to be absorbed because education's doing psychology and physics is doing psychology and healthcare is doing psychology and business is doing psychology and law is doing psychology. Yes, they're absorbing, but the other part of that is it could give us a major role as a convener to bring the great thinkers in those areas together. And it's in those interfaces that the great innovations happen. And we could be the great, we are the holders of the human side of the human behavior technology interaction, I believe. So in 2030, we will be holding the value of the individual, the importance of the impact of culture, the importance of the human being in that human technology equation. And I think we can be major conveners to make sure that technology is done in a positive way and an ethical way and a helpful way for the public. I see more opportunity there. I see a lot of challenges and I see a lot of issues, but most importantly, I see a lot of opportunity.
Mm-hmm. Well, thank you all. I hate to be the one to put an end to this today because it seems like there's been a lot of interest, a lot of passion, and more good questions than we could even get to in our short hour. So I encourage you to, if you had questions that you didn't get answered here today, email those questions to Sandy Shullman. I thought I had a slide here, but it's not coming up for me. So it is Sandy Shullman for apapresident@gmail.com. or Sandy Shullman for apapresident.com for her website. And here pretty shortly, I believe it'll be Friday, September 14th, correct? Everyone will be getting a ballot in their inbox if you're an APA member, asking you to vote for APA president. I encourage you to make your voice heard by voting, and I encourage you to give Sandy your #1 vote. I know I will be doing that, and a number of divisions have endorsed her for their #1 vote as well. So thank you to Sandy and to our panelists here today for all of this really exciting and wonderful information and your perspectives, and hopefully we get the chance to do this again soon.
Thank you, Kevin and Judy. You've been terrific. You're terrific partners. Thank you.
Thank you.
Thank you, Sandy. Thanks, Judy.
And thank you to our audience for being here today.
Thank you all. Really appreciate it. Look forward to hearing from you.